The nurses only knew her as Volunteer Martha, a 76-year-old woman, humble, who came every day to visit patients. But nobody knew that beneath those hands lay the story of a hero who had saved 89 soldiers' lives on the battlefields of Vietnam. Martha Wilson arrived at the hospital every morning at 7:30. Her floral dress, gentle voice, and kind smile comforted patients. The nurses loved her because she never complained, just quietly did her work. But there was something about Martha's hands. When she saw a wound, her eyes would change. As if she knew that wound's story, its pain, its healing process beforehand. Nurse Linda had asked one day, "Martha, how are you so calm with injured patients?" Martha had just smiled. "Habit, honey, habit." But nobody knew that this habit had begun in 1971, 30 kilometers outside Saigon on a battlefield. When those hands had stopped bleeding under mortar sounds, helped soldiers hold on to life in the rain of bullets. Martha's real story had remained hidden in hospital corridors for 50 years. Welcome to the last stand. Do you have an elderly hero in your life like Martha? Someone who serves quietly and never shares their past with anyone? Share with us in the comments. St. Mary's Medical Center was like any other day. Patients coming and going, doctors rushing around, nurses changing shifts. And Martha Wilson, as always, walking through the main entrance at 7:30 in the morning. Martha was 76 years old, medium height, her white hair carefully combed, wearing a blue floral dress. She carried a small bag. Inside were candies for patients, books, and sometimes hand-knitted scarves. Nurse Linda greeted her. "Good morning, Martha. How are you today?" "I'm fine, dear, thank you. How are the patients?" Martha's voice was always the same tone, calm and compassionate. "Mr. Thompson's condition is a bit worse. Family couldn't come today. He'll be alone." Martha nodded. "I'll visit him. He wanted to finish the book we started last week." Martha's routine at the hospital was always the same. First, she'd go to the pediatric ward. There, she'd tell stories to little patients, play games with them. Then, she'd move to the elderly patient ward. There, she'd chat with patients, try to meet their needs if they had any. But Martha had an unnoticed quality. When injured patients came, her behavior would change. She'd become more careful, more focused. Her eyes would show that determined look of an experienced healthcare worker. Then it would immediately disappear. Nurse Linda had known Martha for 3 years. Since the first day she came, she'd been curious about her behavior. Martha wasn't an ordinary hospital volunteer. When injured patients came, Martha's posture would change. Her steps would become more decisive. Her hands would move more confidently. Once a young man who'd had a motorcycle accident was brought in. Linda had seen Martha standing beside the patient, assessing the wound's condition like an expert. "Martha, have you worked in a hospital before?" she'd asked one day. Martha had just smiled. "No, dear. I just love helping." But Linda had noticed. Martha's use of medical terms, the way she assessed wounds, her understanding of patients' conditions. These weren't the knowledge of an ordinary volunteer. Another strange thing was Martha's tone of voice. When very injured patients came, Martha would calm down. When other volunteers panicked, she'd become even more composed. As if she'd encountered such situations before, knew how to act. Nobody knew much about Martha's marriage. She'd say her husband died 15 years ago. They had no children. But when talking about family photos, she'd experience a strange silence. One day, a photo that fell from Martha's bag had caught Linda's attention. In the photo was a young woman in military uniform. But Martha had immediately taken the photo. "Who is this, Martha?" Linda had asked. "An old friend," Martha had said, but there was tension in her voice. Martha's hands were also noteworthy. Despite being 76 years old, her hands were very confident and decisive. They never trembled. In delicate tasks, when dressing wounds, she'd act as if she'd done it for years. And that old bag. Martha's bag she brought every day had strange things in it. Linda had seen one day. A metal box with various medical supplies inside. These weren't things a normal volunteer would carry. It was the night of November 23rd. Martha was about to go home when she heard the ambulance siren. There had been a major traffic accident. Multiple trauma cases were coming. The emergency room became chaotic. Doctors and nurses started rushing around. Martha was also getting ready to leave when she stopped. A voice inside told her she needed to stay there. When the first ambulance arrived, there were 6 injured. 2 were very serious. Martha stood in the corner of the emergency room, watching what was happening. "More ambulances are coming," shouted a nurse. "We won't have enough room." At that moment, the second ambulance arrived. Inside were even more seriously injured patients. Doctors couldn't keep up. Nurses looked helplessly. Martha took a step forward, then stopped. She was experiencing an internal conflict. She didn't want to reveal that past she'd hidden for 50 years. When the third ambulance arrived, the situation got out of control. There were 12 seriously injured patients in the emergency room. The number of doctors was insufficient. Nurses had panicked. One was especially bad off, a young soldier who'd had an accident while on leave. He had a deep wound in his chest, was losing a lot of blood. "Blood loss is too much," shouted the doctor. "We need to get him to the operating room, but there's a line." Nurse Linda looked helplessly. At that moment, Martha came over. "Let me look," said Martha. Linda was surprised. "Martha, you." But Martha had already gone to the patient. She examined the wound, checked his pulse. There was no hesitation in her movements. "Get me a clean cloth right away," said Martha, giving orders just like a doctor. "And saline solution." Linda watched in amazement. Martha's hands seemed to be on autopilot. She cleaned the wound, applied pressure, stopped the blood flow. "This won't work," said Martha. "He needs to be taken to the operating room. But first, let's do this." Martha, while cleaning the soldier's wound, used an old technique, a special bandaging method. Linda had never seen this before. "Martha, how do you know this technique?" asked Linda. Martha stopped. Her hands were still over the soldier's wound. A 50-year secret was about to be revealed. I used to be a medic," said Martha quietly. "A medic? At which hospital?" Martha took a deep breath. "Not at a hospital. On the battlefield." Linda's eyes widened. "On the battlefield?" At that moment, the doctor came. When he saw the soldier's condition, he was surprised. "Who performed this intervention?" he asked. "Martha," said Linda. "She." "Very professional intervention," said the doctor. "Who are you?" Martha quietly answered. "Army Medical Corps, Vietnam 1969, 1972. Everyone in the emergency room stopped. Nurses, doctors, everyone looked at Martha. "You're a Vietnam veteran?" asked the doctor. Martha nodded. "I used to be. Now I'm just a volunteer." Dr. James Richardson had worked at this hospital for 25 years. He knew Vietnam veterans, but Martha was different. Female military medical personnel were very few in that era. "Which unit were you with?" asked Dr. Four. "Richardson, 23rd Medical Battalion," said Martha. "I served around Saigon. What did you experience there?" Martha stopped. Nobody had asked her this question for 50 years. Her eyes became moist. "I experienced a lot, doctor. A lot." Linda's curiosity increased. "Martha, you never mentioned any of this." "Because I don't want to remember those days," said Martha. "But tonight, this young soldier, I used to try to save kids his age over there." Dr. Richardson looked with understanding. "How long did you stay in Vietnam?" 3 years, from 1969 to 1972. "Those were very difficult years." "They were the most difficult years," said Martha. "But those boys needed help. They were all far from home, alone, wounded. Someone had to take care of them." Martha didn't go home that night. She sat in Dr. Richardson's office, telling memories she hadn't shared with anyone for 50 years. "My first assignment was at a field hospital outside Saigon," said Martha. "I was 19 years old. I didn't understand anything, but I had to learn." "How did you start?" "I just graduated from nursing school. I volunteered for Vietnam. My mother was very upset. She said girls don't go to war, but I wanted to go." Martha's eyes looked far away. "My first day was terrible. Helicopters were coming, bringing wounded soldiers, blood, screaming, crying. I wasn't ready at all." Dr. Richardson listened carefully. "Do you remember your first patient?" Martha's eyes filled. "Danny Rodriguez, 20 years old, from Texas. He'd been shot in the leg. He was so scared he kept saying, 'I want to go home.'" "What happened to him?" "We saved him. 3 weeks later, he went home. He'd written me a letter. He said, "Nurse Martha, you're my angel." The hard thing, said Martha, was seeing death every day. 18, 19, 20-year-old kids were coming. Most could be saved, but some. Martha stopped. This part was the hardest to tell. Michael Thompson, 18 years old, from Ohio. He'd been shot in the chest. We operated for hours, but we lost him. That must have been very sad. I cried that night. I cried a lot. But the next day I had to come again. Because other kids were coming too. Martha's voice was trembling. My hardest day was in 1971. There'd been a mortar attack. 15 wounded came at once. Our doctor count was insufficient. I had to perform simple operations too. You performed surgery? Yes, bullet removal, stitching. In those situations you learn. Either you learn or you lose your patient. 89 soldiers, said Martha quietly. That's what's written in the official records. I saved 89 soldiers' lives. Dr. Richardson was amazed. 89? That's a very large number. But I lost 23, said Martha. Tears were flowing from her eyes. I couldn't save 23 kids. I still remember their names. Martha, you saved 89 people. This is an incredible achievement. But I can't forget those 23. Robert Wilson, 19 years old. James Miller, 20 years old. David Brown, 18 years old. Martha was counting the names. She paused at each name, as if reliving that moment. It's not your fault that you couldn't save them, said Dr. Richardson. I know, said Martha. But the heart doesn't think that way. I've been telling myself this for 50 years, but it still hurts. What did you do after returning from Vietnam? Asked Dr. Richardson. I continued working at the hospital, but a civilian hospital. I wanted to leave the war experience behind. Did you get married? Yes. I met Robert in 1975. He was also a veteran. He'd served in the Army Corps of Engineers. We understood each other. A sad smile appeared on Martha's face. Robert knew these stories. He was the only person I could tell, but he also passed away 15 years ago. Didn't you have children? No. We wanted them very much, but it didn't happen. Maybe it was for the best. I'd seen too much pain. I don't know if I could have been a mother to a child. After Robert passed away, I became very lonely, said Martha. Sitting at home was making me depressed. One day while reading the newspaper, I saw an ad that the hospital was looking for volunteers. And you came. I was very scared the first day. I wondered if my old memories would come back. But being at the hospital relaxed me, helping patients, talking with them. It was like a missing piece in my soul was falling into place. You've been here for 3 years. Have you ever regretted it? No, said Martha decisively. This hospital became my second home. These people became my family. You all accepted me, didn't question me. Dr. Richardson smiled. You're a special person, Martha. We always felt that. Martha, said Dr. Richardson, did you ever receive medals in Vietnam? Martha stopped. She hadn't expected this question either. A few, she said quietly. Which ones? Martha took out a small box from her bag. Inside were 3 medals: Bronze Star Medal, Army Commendation Medal, and... Martha stopped. And? Medal of Honor. Dr. Richardson's jaw dropped. Medal of Honor? Martha, this is America's highest military medal. I know, said Martha. But I don't think I deserve those medals. I lost 23 people. It's like I received a medal for every person I lost. Martha, what did you do to receive the Medal of Honor? Martha took a deep breath. This story was the hardest to tell. 1971, October 15th. There'd been a major attack. The hospital area had been hit. There were 27 wounded soldiers, but ambulances couldn't come. Enemy fire was too heavy. What did you do? I left the hospital, alone. I carried the wounded one by one to the hospital. It took 6 hours. Bullets were whizzing around me, but I couldn't stop. Dr. Richardson was amazed. You saved 27 people by yourself? I saved 18. I lost 9 on the way. Those 9 people still visit me in my dreams. Martha, you saved 18 people's lives. This is incredible heroism. "No," said Martha. "I just did my job. It was my duty as a nurse." The next morning there was activity in the hospital corridors. Martha's story had spread among the staff. Everyone had learned that this humble volunteer was actually a great hero. When Nurse Linda saw Martha, she ran to her. "Martha, why didn't you ever tell us these things?" Martha smiled. "Because it's in the past, Linda. Now I just want to help my patients. But you're a Medal of Honor recipient. This is a great honor." "Medals aren't important, dear. What's important is being able to touch lives." That morning, patients coming to the hospital looked at Martha differently. Everyone knew she was a hero now. But Martha continued her same humble behavior. When the local newspaper heard the news, they called the hospital. Martha Wilson's story was attracting great interest. But Martha refused to give interviews. "I don't want to talk to the public," she told the hospital director. "I just want to be with my patients." But the news still came out. It was published in the local newspaper with the headline, "Heroes Silent for 50 Years." The story attracted great interest. Former Vietnam veterans were calling the hospital saying they wanted to talk with Martha. But Martha was turning them all away. "The past should stay in the past," she would say. A week later, special visitors came to the hospital. 4 elderly men, all Vietnam veterans. They wanted to meet Martha. "We want to thank you," said one of them. "If there weren't people like you, we wouldn't be alive." Martha started crying. She hadn't heard such thanks for 50 years. "I just did my job," she said. "No, ma'am," said another veteran. "You were our lifesaver. Thanks to the sacrifice of medics like you, we were able to return home." That conversation was healing Martha's soul. She was understanding that the guilt she'd carried for 50 years was unnecessary. The hospital administration decided to organize a special ceremony for Martha. Martha initially objected but finally had to accept. On the ceremony day, the hospital hall was full. Staff, patients, their families, veteran friends. Everyone had come to honor Martha. Hospital director Dr. Patricia Hayes spoke. "Today we're honoring a special person among us. Martha Wilson has served quietly for 50 years, never shared her past with anyone, but now we know she's a great hero." Martha stood on stage, her eyes moist. "Martha's story teaches us what sacrifice, humility, and silent service mean," said Dr. Hayes. The most emotional moment of the ceremony was when Martha was given a plaque. The plaque read, "Martha Wilson, Vietnam War Army medic, Medal of Honor recipient, 50 years of silent service, our hospital hero." Martha trembled as she received the plaque. The identity she'd hidden for 50 years was now known by everyone. And she was happy about it. "Thank you," said Martha. "This hospital became my home. You became my family. The 3 years I spent with you were the most beautiful years of my life." The hall was applauding while standing. Elderly veterans were saluting with tears in their eyes. Nurse Linda came on stage and hugged Martha. "We love you so much, Martha. You're our hero." After the ceremony, Martha's life changed. She no longer hid her past. She was telling young nurses about her Vietnam experiences, sharing her medical knowledge. The hospital administration made Martha a special offer to establish a veterans counseling program. "In this program, you can help both our veteran patients and staff," said Dr. Hayes. Martha accepted the offer. She would now work not just as a volunteer, but as a professional counselor. On her first day, she spoke with 3 veteran patients. All were people who'd experienced trauma, had problems with their families. "I also experienced what you went through." Martha told them, "Don't let the past take you prisoner. Turn your pain into goodness." Months passed. Martha's program achieved great success. Hundreds of veterans straightened out their lives with her help. The local television channel wanted to interview Martha. This time, Martha accepted. "What's your message?" asked the reporter. "Don't run from the past," said Martha. "Use the pain you've experienced to help others. Each of us has a hero inside. We just need to have the courage to bring it out." After the program aired, letters from across the country started coming to Martha. Former soldiers, nurses, healthcare workers. Everyone was thanking her. Today, Martha Wilson is 77 years old. She still works at St. Mary's Medical Center. The Veterans Counseling Program has become one of America's most successful veteran assistance programs. Martha's Medal of Honor hangs on the wall of her office. But next to it is something more valuable, a list with the names of the 89 soldiers she saved. "Each name is a life," says Martha. "Each life means a family, a future. I just gave them a second chance." Martha's story teaches us this: real heroes serve quietly. They don't expect praise, don't live for medals. They just live with the inner peace that comes from helping others. Martha Wilson still comes to the hospital every morning at 7:30 today. Her floral dress, gentle voice, and kind smile. But now everyone knows that those hands are the hands that saved 89 soldiers' lives on the battlefields of Vietnam. And Martha's greatest happiness is this: she's now at peace with her past. She doesn't blame herself for losing 23 people, because she understood that having saved 89 people is the greatest achievement of her life. If you enjoy these powerful stories, don't forget to subscribe to the Last Stand channel. We'll continue bringing you more hero stories every day. Martha Wilson's story doesn't end. Every day she helps new veterans, touches new lives, because she knows that real service continues until death. And maybe there's a Martha Wilson in your circle too. Someone who serves quietly, doesn't share their past with anyone, but actually has a great heroism story. Discover them, honor them. Because every hero story inspires future generations. Like Martha Wilson, quiet but strong. "I just did my job," Martha still says. But that job means saving 89 soldiers' lives, giving hope to hundreds of veterans 50 years later. Martha Wilson, Vietnam War Army medic, Medal of Honor recipient, and most importantly, silent hero. May this story be a tribute to her and all silent heroes like her.